This COVID unit in a 600-bed San Francisco hospital has only 20 patients. For medical staff who plan for a tidal wave of suffering here, it's disorienting.
Many of us here on the front line feel a sense of guilt, and seeing the suffering from colleagues who are across the country in Elmhurst, New York City, in New Orleans, in Michigan.
In fact, things are going so well that UCSF plans to send a portion of its medical staff to New York.
It's got to feel different if you're in China or you in Italy or now in New York. It definitely does not feel that way here.
So the objective here was to flatten the curve so that we could take the pressure off of hospitals. It sounds like we have definitely done that here in the Bay Area.
No question about it.
Why such an extreme difference? Well, lower urban density, wealth, and luck certainly played a role, but acting while the caseload was small seems to have made a big difference. San Francisco, Berkeley, and 5 Bay Area counties issued stay-at-home orders on March 16th, 8 days before the first death in San Francisco.
You might say a week, could that make a difference? But this is the thing about exponential growth. A week can be a lifetime when it comes to this thing.
Plus, in early March, some of the Bay Area's biggest employers, Facebook, Google, Apple, told their people to stay home. Dr. Wachter also says San Francisco's low smoking and obesity rates may have kept people from becoming very ill. The state of California was the first to order shelter in place. Because of that quick action, according to a widely used model, projected deaths in the state of California will top 1,600 by August. But in New York, a state with roughly half California's population, the model projects a much higher death toll, more than 13,000. When will these streets be filled with people again?
You have to have the public health capacity to do the testing and do the contact tracing. You have to have the hospital capacity to take care of patients. And probably the most important, the number of cases has to be going down to almost nothing and staying down.
Health officials don't know when that will happen. So for now,
prepare for the worst, expect it, but hope and pray that we don't ever have to deploy those resources.
Jacob Ward, NBC News, San Francisco.